Good Friday evening, everybody. Christine Barconi here, live in our streaming center. It is week 2 of our series with Nationwide Children's Hospital ahead of their new behavioral health pavilion opening. Very exciting time for you guys. I am joined by Head of Nursing. Introduce yourself. Let us know. Tell everybody your name, what you'll be
Yeah.
doing, and your role at the new pavilion.
Yes, my name is Stacy Ben. I'm the Director of Nursing for Behavioral Health Pavilion. It's our Big Lots Behavioral Health Pavilion, and I am working to build the staff and help train them and get our nursing staff together so that we're ready to care for these kids.
And I know you guys, this has been in the works for a
Oh, yeah.
very long time.
Very long time.
Just kind of talk to everybody again about why this is so essential to our community and how it's going to help the children of Ohio.
Absolutely. It's going to help children and families. Being able to bring access to services is going to be huge. So we currently have services at the Nationwide Children's Hospital, but we're looking at how we can expand those services and provide more care to kids in the community. And there's a shortage of facilities being able to do that. So we wanted to step in and step up.
So this week we were specifically talking about watching for signs in
Yes.
your child. Can you tell us a little bit about those
Yes.
signs and again, what can parents be on the lookout for?
Absolutely. So we need to be on the lookout for various things. Kids who are withdrawing from their friend groups, not finding enjoyment in some of those activities that they used to find, fun, things like their basketball or, sports or extracurricular activities. So when those things kind of happen, we want to make sure that we're having conversations with our kids. Sometimes kids will not spend time with their families as well. So we want to consider what's going on and have that conversation.
Here's another slide I'm putting on the screen for you guys right now with some of those signs that Stacy is talking about. We have a link in the description of this video talking about children's mental health and the prevalence of mental illness among youth here in throughout the world and in
Yeah.
the United States. Can you kind of talk about that? And it says here 1 in 5 teens in the United States has a mental health disorder. What
Yes.
is the spectrum?
Oh my goodness. So are you referring to just different diagnoses that you would see with?
Yeah, so mental health can be a broad term.
It can be very broad. So it can
Exactly.
be from depression to hallucinations. It varies. You may have some kids who have attention deficit disorder or ADHD as well. You can see kids in various, situations, but their ability to function in school, their ability to function in social settings, it can be really challenging for families.
Now, we opened up our comments to
Yeah.
some questions
Yeah.
by some viewers, and most of them we didn't get any like specific questions, but we
Yeah.
did get testimonials
Yeah.
about from parents who have um, sought help for their children. And it seems like anybody who's reached out for help, they don't
Hmm.
regret that at
No,
all.
they do
You're
not.
never going to regret it. So even if you're on the borderline of thinking you might want to, even if your child doesn't end up needing extensive care, you're never going to regret
No.
making that first step, right?
No, you're not. And I've had an opportunity to see how the behavioral health services at Nationwide Children's has made a difference in families' lives, and you will find people who will talk about that testimony. Just to be able to connect with someone, get advice, get an understanding of what they're actually dealing with, because there may be some underlying pieces that they're not even aware of, especially when it comes to understanding the diagnosis that go with those different disorders.
Tell us about the new, the specifics on the new mental health pavilion
Yes.
and the services that you guys will be offering there, and just kind of the details surrounding when you guys will be open and
Yeah.
who will be open to.
So when we open up, we're going to be really expanding our services that we currently have. So we have outpatient services. We also have a very small inpatient service, and we're really looking at how we can expand that and open that up to the community. Our goal is to provide services for Franklin County youth who are in need, and we know that there are a number of kids who may not have even accessed service before, but really looking at how we can find the best level of care. We'll have inpatient, partial hospitalization, as well as a psychiatric crisis department to be able to assess what the needs are for various kids and their families.
Right, Stacey, I know you guys are opening up very soon, but
Mhm.
if somebody is in need of care right now, we just want to give you guys some information on some resources that you can access right now. If you're in an emergency, life threatening situation, always call 911 or go to an emergency department. For crisis situations that are non life threatening, please call your county psychiatric crisis lifeline. In Franklin County, that number is 614 722 1800. That's for youth and adolescents 17 and under. Ages 18 and older should call 614 276 2273. And if someone you care about is having thoughts of suicide or they need to talk to somebody, please encourage them to call the National Suicide Prevention Hotline. That number is 1 800 273 8255. Or if you prefer, please text START to 741741. A live trained specialist will get back to you at that texting number as well as at the phone number that I just listed. All that information that I just gave to you, as well as the information that Stacy was just talking about, is in a link on our website, nbc4i.com. It's listed if you're watching on Facebook or YouTube in the description of this video. Please go there for more information. And we're going to be continuing this series every Friday in February. This is just week 2, and we hope this helps. Reach out. If you have any questions, please leave them in the description, in the comments of this video, and we can address them in next week's video. Stacy, we want to thank you so much for being
Absolutely.
here with us today.
Absolutely.
Is there anything else that you would like to add before we wrap up our interview?
Yeah, just a big thanks to the community for the support that they're providing us.
Awesome. Thank you so much, Stacy.